Why labor is painful? Well, in almost all pregnancies, labor begins with mild contractions that come and go. As labor progresses, the contractions will also occur more frequently and their intensity will also increase, right? Although a few women have reported experiencing little to no pain during labor, but the process is painful for most people. Remember that. The contributing reasons are, first of all, the reduced oxygen supply to the uterus muscles during contractions. And that is why we ask you to practice breathing during labor. Number 2, stretching of the cervix as it dilates, pressure of the babies on the cervix. Number 3, tension and stretching of the ligaments of the uterus and your pelvic joints. Okay. Number 4, pressure of the baby on the urethra, bladder and rectum. And number 5, stretching of the pelvic floor muscles and vaginal tissues during the birth. So, although these changes can hurt, but it's an expected side effect of a normal labor process that lets women effectively push their babies out. For this reason, labor pain is often called pain with a purpose. Take care.